pronouns, that would be great. So if you also could keep your microphones muted, unless we're asking questions or if you've been asked to unmute. And if you do have a question or something to say that relates to the topic that we're talking about, you can use the raise hand function, and that's located in the menu screen under reactions. And other questions that are not related to the material tonight can be written in the chat, and we will get back to you. And we do encourage the use of the chat. It will be monitored, so anything that you want to say, put right in there. And we will be enabling the closed captioning for live transcript. And if you would like to use this feature, you can go to the bottom of your screen, and that is on the live transcript button. It says CC, and there we go. So who are we and what do we do? We are Rights and Democracy. We are fighting for healthcare as a human right that is guaranteed by our government. This means that we want a healthcare system that supports healthy people and community over profits, guarantees for all when we need it, guarantees care for all when we need it, regardless of where we live or who we are. And our core team is myself, Marcella Termini, Jody Newell, Jonah Wheeler, Laura Mitchell, Laura Lynch, Lynn Merlone, Candace Moulton, and Beverly Pietlicki. And our rad staff organizer is Heather Stockwell. And now I am going to pass the mic to Jonah.
Thank you, Marcella. Sorry, I was off camera. I'm dealing with my car right now. It's a broken car. The realities of America. It's very fun indeed. So I'm going to talk about the Care Over Cost campaign and name that this is the strategy that we believe to get us to Medicare for all. For-profit healthcare insurance companies spend millions of dollars every year to keep our elected officials from passing universal health care through lobbying and all these other things. They do this so they can stay in business, making billions of dollars from profiting off of our healthcare needs. The problem is that they charge too much money so people can't afford to pay for their healthcare, and they fail to cover care and our medication that our communities need. They put their profits over our care. Which company puts their profit over your care? This is a moment where we're going to please ask to put in the chat what your healthcare company is. What are the companies that are putting your care over, or their profits over your care? Even though we think that we might have good healthcare, this is still the case for all these companies, as you just saw in that graphic. Organizing people with private insurance is the key to getting us Medicare for all. And as I just said, 66% of people in America have private insurance, and 70% of those people think that they have good insurance. That's 9% less than Medicare, but still a lot of people. And in order to get to that new system, we have to organize those people and show them that there is a way in a better system. The problem is that those numbers go way down when people have to use their health insurance because they are injured or sick. They think they have good care. And then when you actually have to use it, the realities of that insurance, the realities of that care come into play. Then people feel the pinch of deductibles and copays. Then people feel the real costs of out-of-network billing. Then people feel the real limitations of coverage that is not universal or comprehensive. Goals of the Care Over Cost campaign are to win real improvements, elevate the stories, stop health insurance companies. And the first steps for the Care Over Cost campaign will be to reach out to over 800,000 people, go public with these stories, find people with denied claims, and demand companies stop giving money to politicians. how are we going to find people to join us? We can text bank. There's going to be a text bank March 30th, 5 to 7. There's a phone bank Tuesdays, every Tuesday, right? How it is every Tuesday. Every Tuesday, 5 from 7:30 with Rights of Democracy. And this summer, very excited. I'm personally very excited for this. We're going to be getting back into in-person events, rallies and stuff. And there's going to be a lot of opportunities for people to table and meet people in person and really get into the groundwork of this work. Social media, sharing the Care Over Cost survey on your personal social media and just getting the word out there. And traditional media, if you're one to write letters to the editor or op-eds or do testimony at the State House, or if you have a public speaking opportunity, mention this campaign, mention that there's an actual way for people to channel their anger and angst about a system which is exploiting them. I lost where I am.
It's all right. We'll be sharing the links for these in a couple minutes, just so folks know
Sure,
that
thank
we're
you.
at our break point.
And sorry, can you just tell me which slide this is?
Yeah, I should have sent you the slides actually instead of that, because they might be a little bit off. So we're on number 9. This is for me, pressuring insurance companies.
Well, sorry about that. It's just a little bit, it is definitely a little bit off. But how are we going to put pressure on insurance companies and make people understand the problems with them? Well, I've already sort of mentioned this, but sharing stories through letters to the editor, op-eds, testimony, and speeches. That's one of the best ways. I mean, hearing the realities of it, hearing the realities of what people are going through, whether that be with Medicare or Medicaid, with too much paperwork and too many problems with a system that has been overbloated with bureaucracy, or private insurance. Speaking the reality to those stories and telling your story about healthcare in America, so that the people in power can't say, "Oh, but there's people that have good insurance." They cannot debate a story, and those are some of the most important things that we can use. Organizing people to call in, email, or to local insurance companies to complain about care and cost, or social media thunderclaps where we can take action together on the same day. Using those stories, using our collective message to bring people together and show the world that there are people who believe in a different healthcare system. Demand group meetings with local executives and elected officials. If that doesn't work, where you can share stories directly to their face, where it's not, they can't ignore your email. They wouldn't be able to ignore your story right in front of your face. And if you're able to get a meeting with your legislator, which we are lucky to be able to do here in New Hampshire, because we have so many people, then it's a lot harder for them to say no to that meeting, or to you in that meeting. Attending and organizing local rallies, protests, and direct actions at corporate insurance offices. Peaceful, but protests nonetheless. Showing up in front of their buildings, showing up and showing them that there are people who don't stand for what they're doing. Moving on to the next slide, claim denials. One way insurance corporations put their profit over our care is that they issue millions of claim denials every year. A claim denial is when an insurance company refuses to pay for the care or medication or treatment that we need. Claim denials from insurance means we either don't get the care or medication we need, or we get stuck paying for all of that care or all of the medication. Totally counter to what insurance is supposed to be. The scale of these claim denials is shocking. Just looking at the 122 big insurance companies that are part of the Affordable Care Act in 2019, so just a fraction of the insurance industry, those insurance companies denied 17% of all claims submitted. In New Hampshire, the rate is 31.9%. That's almost double what the national rate is. That's people who have had their claims denied, who have had life-saving medical care denied to them, who have had to pay for life-saving treatment, all because of the exploitation and profits of the insurance companies. It's staggering. Why do these corporations issue claim denials? The only reason insurance companies are supposed to issue claim denials is because the care or the medication you are requesting they pay for is not actually covered by your summary of benefits. But sometimes insurance corporations issue claim denials for care that they are supposed to help pay for in your insurance plan. When this happens, the only way to fix this problem is to go through an intentionally complicated appeals process. Out of those, only 40 million people received claim denials. Out of those 40 million people who received claim denials, only 0.2% of people appealed their claim denial. And even less of that 0.2% win those appeals. So it's a convoluted process that almost no one goes through. And the corporation is able to deny claim without repercussion whatsoever. This is a massive problem. Millions of people are being denied care, and less than 0.5% of people are taking action to get their insurance company to pay for it. We want to start building relationships with people in our community who are dealing with this problem and make a plan to hold insurance companies accountable. We need a system of care over cost. Why do insurers? Oh, sorry. That was the script messing up again. But now we're going to go to a break. Heather will send out the care over cost survey. And if you have any questions or comments, please feel free to use the chat or raise your hand, and we can definitely answer those for you. But thank you for listening, and I hope you join in this work. Thank you.
I'm going to stop the share. How about that? We're getting ahead of ourselves. So this is just a little break to absorb some information, because that was a lot. Thank you, Jonah. That was awesome. And I'm going to put this, yeah, has nobody shared yet that link yet? So I can grab that right here. This is care over cost survey, and I'll even open it up and share it with you all in the meeting. How about that? That's the link to our survey. It's pretty quick. It's not a ton of questions. You can expand on those questions more or less. Just we're happy to follow up. I guess what I'm trying to say is we're happy to follow up with you and help you develop your story more, and so that you're really ready to share it. And I was thinking I might share this, but my computer's being a little wonky. Yeah, let's just share it again so people can see what you're going to open. If you're concerned, it's a secure site. Yeah, here it is, care over cost. It's time to put big insurers. Big insurers put people over profit. I'll get the words right one of these times. If you're very well in our system already, so this may come up already populated with your name and address. And then if you just scroll down, we ask just a couple of questions. Tell us about your healthcare experiences. Do you have health insurance? And if yes or no, and if you don't, we would definitely like to hear how that impacts you. And if you do, which most people I think do, at least here tonight, or I'm going to say, I'm going to guess that are probably probable, but how do you get your health insurance? Is it through the marketplace? Is it through your employer, Medicare, Medicaid, VA? We have another survey for you. If you are on Medicaid, we'd love to talk to you about that and what barriers you're facing. But we want to know a little bit more. We want to know about who your insurance provider is, so that we have good data on who the worst actors are in this arena. And then you know, we know there's a lot of bad things about health insurance, but we also want to know what's good about, what do you like about your health insurance, as well as what problems are you facing. And then the last question is, have you ever been denied a claim? And we want to hear about that too. I personally was denied a claim, or my family, and wrote about it. It was published in the Concord Monitor back in January. And we're going to hear from one of our core team members next, once I stop sharing this again. And we're going to hear about Jody's story of denial. Now I'm going to just spotlight your video so that everybody can see you. There.
I'm huge. Hi, everyone. My name is Jody Newell. I go, use she, her pronouns, and I'm from Keene, New Hampshire. I just wanted to share a little bit about my story. A little over 3 years ago, the night before Thanksgiving, I shattered my wrist in a serious fall. I was visiting with my family in Massachusetts, so my brother brought me to the closest, my mother brought me to the closest ER, where they stabilized it for the time being and sent me off with instructions to seek further care. When I returned home 3 days later, I found that a pipe had burst in my kitchen and had been spewing water all over the entire first floor of my house for days. It was a complete disaster area. 2 days later, as we showed the insurance inspector the damage, my dad, who had driven up to help us, received the call from my mother that she had found my brother unresponsive. He had died that morning. Now, I understand that these things sound somewhat irrelevant to the subject at hand, right? We're talking about medical insurance, but my intention is to convey that we're all human, right? And we're all dealing with so much else in our lives. I anticipated a fight with the homeowner's insurance company, and boy, did I get it. What I did not anticipate was a fight with my health insurance company. While I was aware of claims denials, had plenty, I felt secure in that at this point I had good health insurance through my work, and I sought care at my primary care provider. The hospital checked coverage before my surgery was scheduled and rechecked it the day of. Even in my devastated state, with the help of family and the amazing team at Cheshire Medical Center right here, we had done everything by the book. We crossed our T's and dotted our I's, and yet still, a month after surgery, I received the bill. Blue Cross Blue Shield had decided that over $7,000 of this claim was my burden to bear. For 2 years, myself, my mother, who was the bookkeeper at my work at the time, and our insurance made call after call trying to sort out the situation. We had no idea why it's denied, and nobody seemed to have an answer for why. Now, I was incredibly fortunate at the end of the day to finally find the right person to correct whatever this coding error was and resubmit my claim successfully. And have my family and friends, my work and my family to help me cover the remaining deductible. But I know how hard I had to fight, the hoops I had to jump through, and the time I had to invest, especially at a time, that kind of time. Not everyone has that time, awareness, or support. We're doing this work nationally with our parts of, okay. So what I want to talk about is essentially the way that we share our stories and how those can be conveyed in such a way, right? So Heather, can you put on the, let me go through the slides, right? Sorry. One second. I'll do a little a little waiting music. I can't hear you, Heather. You're muted.
Oh, I said it was. It's almost like Jeopardy, just a little bit different. All right, we're back. Oh, is it going to go there? It's loaded, and there's Jody. When Jody was running for city council.
Yeah.
All right, I think we're ready.
So we want to talk about the power of stories. Storytelling is a powerful tool because what they can do is decrease defensiveness, enable people to process information that they process information differently than they do with facts, teach complicated concepts through storytelling, reduce prejudice or bias, and change opinions and behaviors. In other words, stories are amazing. So developing your healthcare story, right? What do we need to do? So we need to consider a few things. What life experience has impacted how you think about our healthcare system and the role of government? What are the underlying assumptions needed to believe your story? Where is the conflict in the story? And then who are the characters in your story, right? Consider your community, your industry, your profession, your employer. One thing that's very important is to make an emotional connection. And in order to do that, you have to dig deep, right? Don't make it feel like a resume. You want to use imagery and foreshadowing, interesting and emotional, right? You want to open the door and let people into your world. So ask yourself who you are, how you feel, and what you care about. When have you struggled and needed support the most, and who is there to help you? Then, of course, which facts does your story personalize? Consider referencing statistics or studies in your story. All right, so let's talk about the different elements of your story. So you want to give humanizing, empathy building details. If you're telling your own story, what moment did you realize this healthcare issue is serious? Relative or solidarity, right? So how do you know this person? If it's, someone else that you're speaking about, what do you love most about this person and what are they passionate about? You want to paint a picture, right? Set the scene, walk your audience through the who, what, where, and when, and how your story and the how of your story about seeking medical care or financial help. So when you're telling the story, what has happened? What challenges has the system created? Has there been fear? How does it make you feel, right? This is about connecting your emotions with the person who's going to be reading the story. Explain the feeling. Did you get support? If so, who helped you and how did that feel? And if not, who was that and why, how did that feel? You want to make a clear point. For example, our government leaders do not reflect the values of their constituents, or I don't think access to healthcare should be based on wealth. So you're trying to connect your story. You're trying to connect your story with a broader point. All right, so the 5 elements of a plot. Exposition, and then rising action up to the climax, and then the falling action to the resolution, right? Perfect little arch there. All right, so we want to do a story writing exercise, right? Try writing your story in 5 sentences. It'll give you a great foundation to build from, right? So if you do 5 sentences, then you can translate that into 5 paragraphs. So the exposition, what we said was the first one, right? You're going to state the problem. You're going to have an opening statement with the basic elements of your story. And then the rising action, how did things develop, such as the diagnosis or other impacts that this illness had. Then the climax is going to be basically the tipping point, right? The bills added up. Like I said, then I received the bill. We couldn't afford treatment. Insurance companies denied our claim or would only pay for a lesser treatment. Then the falling action is basically what was the result? It got so, for example, it got so bad that we lost our house, illness got worse, still needed treatment that the doctor recommended, or in some cases, death. And then the resolution. This is the solution or the call to action, right? What insurance elected officials must do to solve the problem.
Oh, I think. Can everybody hear? Okay, you can hear me now. I couldn't see the microphone icon under the subtitles. I think we're going to break here, and I'm going to stop sharing again. I'm going to try, except that is covering that up. Here we go. And we're going to take a break and try writing a 5-sentence story.
Yeah. So if everybody wants to just take a minute, maybe pull up, since we're all on Zoom, right? Hopefully everybody's got like a little document or something like that you can start and kind of just go through those 5 sentences. And if you have a story, use that structure in order to write your own story. Write your own 5 sentences that you can build on.
And we have a little bit of time. So we were going to give people We're gonna check in about 5 minutes, see where people are at, and if people need a little more time, we'll give you a little more time. And then we want to start like hearing back from folks. So 5 sentences. I know I can write 5 sentences. Can you write 5 sentences, Jody?
Yeah, I think also we should probably put that slide back on or something so that people have the descriptions of what each
I was
sentence.
I was just actually going to put that into the chat.
Awesome. Perfect.
Here we go. And maybe I'll even play some music.
Nice.
Let's see. Did that all come out there?
Yep.
Chat? All right. Cool. Cool. Well, I have a little Ella Fitzgerald here.
You're speaking my language.
Smooth sailing.
Hello?
Yeah. Did somebody need something? Sorry. Oh, Marcella had to pop off. All right, thanks, Ella. That was awesome. How are people feeling? I'm gonna stop that for a second. People need a few more minutes, or do people want to try out reading what they have so far? Anybody? Anybody? Need a few more minutes? Getting a lot of blank stares, y'all. I'm going to take it that people need a few more minutes. Yeah? Beverly, how about you? You need a few more minutes to write something?
I'm on Medicare and I'm completely happy.
I'm sorry, I got a little interference there.
Oh, I was saying I'm on Medicare and I have been completely happy with it. I don't have any complaints. It's been seamless. I've gotten everything I wanted.
That's fine. What we're asking, if you don't have
I know.
a personal story, is to like write it about someone that you know, or like that kind of like a solidarity story. If that makes sense. Does that make sense for folks? Doesn't have to, oh, Ryan says he wrote his. Matt, you got something?
Yes. Yeah, sure.
All right, let's hear what you got so far.
All right.
If you
So,
don't mind going first.
no, I don't mind. You know me, even though it's been a while, I'm pretty open. So my health, I have to go back to when I was 17, when this really was my first time dealing with healthcare injustice. I really like started my political awakening. My mom had to go to the hospital and for a checkup, and they didn't know what was wrong with her. They said it was possible she could have some form of breast cancer, and I remember her coming home and being like, and I was 16, 17, I think, and being like, I don't know insurance is going to be able to cover this. I work at the newspaper. I don't know what's gonna happen. Luckily for her, it ended up being a scare, and it ended up not being cancer or anything. But I remember that was kind of set me off into my political awakeness, if you wanted to say. And then I went into college and did a lot of studying about different healthcare systems around the world, and how it's not really a pipe dream to have healthcare for all. So it's longer than 5 sentences, and it was just off the top of my head because I was doing something. But that's kind of where I start.
Nice. Thank you for sharing that, Matt. I know that's not an easy thing when you're facing a possible diagnosis, and what's running through your head is whether or not you can afford it, or if your insurance is even going to cover it. I mean, I started writing about things that I kind of haven't taken care of because of that fear. And now here I am at like 56 years old going like, oh gosh, 9 more years to get to Medicare. Am I gonna go bankrupt in that time? So yeah, I totally with you on that fear that we all have. Even if you haven't faced a denial, the sort of fear of having those bills is there.
It's just unnecessary.
Yeah, totally. Ryan, you want to give it a shot? I see you said you got 5 sentences.
Sure, I think it might be even a sixth sentence in there, but
no worries. This is meant to help build out a larger story, so don't worry if you're not following the rules exactly.
Okay, I'll give it a try. So, yeah. So here's how I tried to use the structure. So twice in the last couple of years, I've been in extreme debilitating pain, and 911 had to be called on my behalf, and I got an ambulance ride to the ER. The first time this happened, I had back spasms. Once I got to the ER, I was there 5 or 6 hours. The doctors patched me up and sent me home and started on a path of physical therapy and stuff. So I thought stuff was good. And then a month later, I got the bill. And Blue Cross Blue Shield said the ambulance company that took the 911 call was out of network and stuck me with thousands of dollars in bills I couldn't pay and got sent to collections. The second time I got an ambulance ride, I got stung by a stingray while swimming. It was incredibly painful. It actually caused a bunch of infections. The stinger is actually still in my foot. And I was bleeding on the beach. Somebody called 911 on my behalf. And before I got into the ambulance screaming in pain, I thought, well, maybe I should not get in. Maybe I was screaming in pain, but I was like, maybe it'll happen again. I'll get a bill. I just had a kid and, knew I couldn't pay. And of course it did happen again. And BCBS stuck me with the bill, and now I'm in collections. And I think, at the end of the day, that tells me that like Blue Cross Blue Shield, private insurers would rather I never got in that ambulance so they wouldn't have to pay. They don't care about whether we're hurt, whether we're sick, getting better, just that they don't got to pay. And that's messed up. They should be forced to prioritize my care and all of our care over their profits.
Wow, that sounds like an intense time, Ryan. Thank you for sharing that. Anybody else want to try out or just share what you've got, even if you don't have 5 sentences? Beverly, I see your hand raised.
Yes, thank you, Heather. You know, I never have just 5 sentences, right? And I'll just introduce a little bit, but this was really helpful and I'm part of the team. And I just want to thank the team for all the work they put into this, because I've been thinking about my healthcare journey started in 1980 when I was involved in a really bad car accident on the Kankamangas Highway. And I broke both my ankles and my hip. And the one thing that keeps coming up to me, I'm trying to make my story because it's a journey, right? From that point on, moving into the future, I've had a healthcare journey. Different things have happened regarding my healthcare as a result of that car accident. But the thing that keeps coming up is the care. I remember the care that I got in 1980 and the care that I'm getting today for a DVT because related to that car accident, because a chair hit the back of my leg. 2 things came up during this workshop, because these are recent things that have happened. In both cases, my husband just recently discovered he had a blood clot in his foot, and this was a blood clot in my leg. And in both instances, we were pushed to the emergency room. And in both cases, we didn't go to the emergency room. My case was because it was during the time of COVID and I hadn't eaten all day. They wouldn't give me any water in the emergency room. And I was feeling fine. I had no pain. There was nothing going on. And I just had done a scan and I had a blood clot in my leg. So I ended up leaving. And as a result of that, I was able to treat myself at home. And granted, it took a long time for that blood clot to dissolve, but it was all done from home. And the same thing happened with my husband. They did a scan of his foot. They discovered he had a blood clot. They said emergency room right away. He got to the emergency room and he had to wait forever and ever and ever. And he had a 1 o'clock job that he had to get to. So he walked out, went to his job. And then they gave him a prescription and he's on prescriptions at home. And, so I feel like the whole industry is pushing towards, almost like, you're incurring more than you really necessarily need to. And the other thing is the deductibles, right? So I'm in collections as well from 2021 because we have a very high deductible, $4,500 for a family of 3. And so this year we're up there on a new deductible. It's March, and we only have now, I think, a little bit, maybe $1,500. But anyway, my husband went to the pharmacy to get the blood thinning medication. He's on different blood thinning medication than I am. And the doctors did not prescribe a generic. We don't even know if there's a generic brand of this medication. We're going to find out, but $600. So, for, a supply of a month's blood thinners, like $600. Mine is not that. Mine is like 10 or 15, but his is a different type of blood thinner. So, it's just, we'll end up in collections again from 2022 because $4,500, we don't have that sitting in the bank every year. We have to figure out how we're going to set aside $4,500 every year in order to receive, the care that we need. And the care that we need is very, very expensive, so we're guaranteed every year to take on $4,500 worth of debt. We were lucky we have insurance, not complaining, because once we get over that $4,500, they will pick up 90% of our bills. But, it's a lot. It's a lot to deal with, and it's a lot to deal with calling the insurance companies, finding out what's covered. My daughter just found out she has mild scoliosis. She's going to need physical therapy. I mean, it's just endless, you know. I mean, people need health care, you know, and
Sure do.
to have it break you, to have it, I can't imagine going back to work full time ever again. I mean, I have all these conditions, and you know, in order to deal with it and deal with the insurance and the companies and the doctor's offices and calling them back and getting questions answered because they didn't answer your questions when you were in the office. I just feel that, I'm sorry to make this, it's a broader context, but I generally have just a complaint about the healthcare we're receiving in general. Thank you for
Yeah.
listening.
Yeah,
Thank you.
you're raising a good point, I think.
Way
though,
more than
that
5
I-
sentences, sorry.
Yeah, well, that's okay. That's okay. I expected that from you anyway. That's okay. You're a librarian. But I was thinking about the same thing. You know, a lot of people don't have that kind of time and energy when they're working maybe 2 jobs or have a family to be doing all these sort of extra things on top of everything else. Michael, did I see your hand waving up there? Do you have something you want to share? Oh, we can't hear you. Why can't we hear you? Not sure why we can't hear you. It doesn't look like you have a muted microphone. Is that all plugged in and working? Yeah, I'm still not hearing anything. Do you want to try and put it in the chat? Oh, wait a minute. Hang on.
Can you hear me now?
Yep, we can.
Can you hear me
Awesome.
now, right?
Yep.
Something wrong with my headphones, I guess. So yeah, so I continue to have a disability, but since I worked, and I continued working, and I was only working part-time, but I was working more hours than I should be. Of course, I lost Social Security benefits, and they said I owed like $10,000 back to them. And I wasn't really being in control of my money. It was my rep payee for the area agency that I was that I had through my rep payee in. So I'm paying that. But what happened? I lost Social Security, and then I also found out that I'm gonna be losing my Medicare and Medicaid. I think I think next July, I'll be losing my Medicaid and Medicare. And so I had to go with full-time status at my work. And so I went to full-time status at my work, and now Medicaid is saying that some of my class medications under the class category medications are now not going to be covered for through the Medicaid insurance. So, and I was, I've asked if I could get my work insurance and Medicaid together, and my HR manager said I can't. So, so I have to deal with Medicaid at least until I eventually do lose it. But yeah, I just had a medical incident this past week, and I went to the doctor ordered medication for me. I went to go pick it up. They said the medication was not covered through Medicaid and Medicare, so it was going to cost me about $150. So then I had to call the doctor, and it was it was after hours, so I had to call the doctor. The doctor sent another prescription in, and that one would have cost a different variety of the medication. That would have, and the pharmacist said that was going to be more. That was going to be over 200. So like I wrote in the chat, I had to go with over-the-counter Rite Aid brand medication for the medical issue that I had, and it was still almost $40. So, I don't know why that that they don't Medicaid's not covering some of the cost, and that was even with the discount plan from Rite Aid and everything in my insurance, and it was still going to cost over $100 and something. So I was not too happy on Monday about it, but yeah, so I've been having issues with the different classes of medications, how the Medicaid, basically, and Medicare not covering. So yeah, so that's basically what I'm having trouble with right now.
That's incredible, Michael. I know we've talked a little bit about your healthcare situation in the past, but I didn't know you had this sort of new development.
Yeah.
Really sorry to hear that.
Yeah, so now
Definitely need a better system.
they do. I'm hoping that I'll be able to, once Medicaid does finally expire me, then I can get the work insurance. But it's gonna be a mess because it's gonna cost me a lot more than what I have now. So even with Medicare, getting their work insurance, it's still gonna cost me a lot more money, and also they're gonna be copays for everything. I like Medicaid and Medicare for doctor's appointments and things like that. Because it's not out of cost pocket, but medications, for someone like me, with the medications, it's just, I just don't have money to be, if something with my disability, to be able to pay for some of those medications.
Yeah, and I think that a lot of people assume that if you're on Medicare or Medicaid, that everything's just included and you're all set. And that's really not the case. I discover every day talking to folks. I see Don put something in the chat. Don, are you in a place that you can come off mute or even on camera and say hi and unpack that a little bit?
Hi.
Hey, I can't see
Hey.
you.
Oh, that's because I had blue tape over it to keep the NSA from spying on me. And again, I apologize. I'm just so struck by everybody's stories about these insane charges, and trying to get at the root cause of why does everything cost so much is a really unfortunately complex question to ask, and I'm just sort of I'm struck by, and I apologize, I forgot the name of the person who spoke at the beginning and gave us the background, but he was saying that we need to go to the insurance companies and tell them stories and protest. And I'm thinking, I actually don't think it's Jonah. Thank you. It's the insurance companies may not be the ones who will respond to stories. I'm not sure that they care about these stories, that these amazing stories that some of you are talking about. But I do think that our representatives, that the government might care about these stories, because the government is the one that the government is the force that permits the insurance company to set the charges, create the deductibles and the denials.
Sure, I totally, you're naming something I think that is important to talk about, because it's not so much, I get what you're saying. They probably don't really care, right? But at the same time, what we want to be doing is getting that press, right? That media. The media also loves stories, and if we, Ryan, I'll let you chime in on this too, because I know you're really involved with this campaign nationally. I think the idea is more around not necessarily. I get that they won't care, but they need to hear what's happening to people, and the part of the idea is that we want to try to help get some things overturned and possibly change a rule or law that they won't be able to do that they will be held accountable, right? Like right now, if New Hampshire has 31.9% denial rate and the rest of the country only has 17%, then maybe there's something that the Insurance Provider Association, or not the association, but you know what I'm saying? Like maybe there's some, or maybe it's our delegation that can change something when they start to hear all these stories about people being denied care and also not being able to afford care. Like adding up all these like $300, $400 And we know that average families don't even have $400 in their accounts for emergencies. It kills me because that means they're not even getting that, or they're just going to they're getting x-rays and then they can't even afford to do it. That goes to collections and they're not addressing their health issue.
Sure. Yeah. No, I hear you, and I think much of it can be addressed at the state level, but in this case, I'd be interested in our protesting at the insurance commissioner's office.
Yeah, we might do that. We might decide to do that.
You know, because I think that the rules that govern how insurance companies can behave in the state is controlled by the insurance department.
That's who I was thinking of, not the provider association, the insurance.
Yeah, yeah, but you
Yeah.
know, and you know, if you do a root cause analysis and it's capitalism on steroids, that's the problem. But if we're thinking about who should hear these stories, and I should shut up and hear and let other people tell more stories. But I'm really right with you and trying to get these stories heard, and then we just need to make sure that the right people are hearing them.
For sure. And I think you're right. I mean, I think the stories can be used in multiple ways, not just at the insurance company. I mean, stories are used for multiple things. They can be used for testimony. They can be used to write an op-ed or an LTE in a newspaper, or get an interview with a newspaper or, you know, or news station. And then it will start highlighting this problem. Oh, what's showing
Well,
us?
yeah, and I think, yeah, this is a right on conversation. Hey, y'all, Ryan. And I think when I think of the act of like telling the stories to the insurance companies in a way aren't the real target. It's like we're there because then that is what creates the tension of conflict that like the press likes, and then people are more likely to pick up in social media, much like, you know, when there are protests against pipeline and they're protesting outside the corporate office or protesting the pipeline installation, the real target they want to move is, yeah, exactly right, the government authorities who've got the power to move them. But it's that let's bring the you know, the conflict and the pain to those who brought it to us, and that's what I think can garner more public attention.
Yeah, that's a great way to frame that. Thank you, Ryan. Do we want to, does anybody else have a story they are ready to share, or a few sentences? Is that you, Jim?
Me?
Yeah, I thought you came off mute. Like,
Oh yeah, I did. Well, yeah, but I still don't have a story, but I do think it's important to stress that the good stories, that's why I mentioned that on Medicare, that everything works really well. You know, it doesn't cover everything like Medicare for all would, but you know, it's seamless from when I had a good insurance to Medicare. Nothing changed. I've had operations, I've had all kinds of care. I can almost like just send a note, say I'd like to have this blood test or whatever, and I get it. You know, the thing is, there is a system there that already works, and people have to know that. You know, that we have a system. It's so easy. It would be so, you know, relatively easy to switch over. We wouldn't be building a whole system from the ground up.
yeah, that's another great point, right? Like, I think a lot of the folks that are, Jim, I'm going to mute you because you got some kind of weird feedback or something. There. Yeah, I totally lost my train of thought. Sorry. That it is, I mean, I think that Pramila Jayapal and Debbie Dinkle talk about that. They're the two women that sort of rewrote Bernie's bill for the House over the last few years ago, I guess now. And I think that was sort of their intention. I mean, Pramila says that in a lot when she's talking about that bill a lot, is that, you know, we talk about creating a whole new system, and that would be a lot to create a whole other system when we have this one. And I will just say though, there are, and yes, we could do that if we wanted to, right? Like if we really wanted to as a country, I believe we can do it. I don't know where I was going with that. I had another point to make, but that's okay. It's okay. I want to make space for others. Does anybody else have, yeah, Tina, I see your hand raised. Let's hear
You
from
know, I do kind of agree that we kind of need to redo the system because younger people are going to have a different experience than older people, partly because coverage and access to basic needs and everything gets worse over time, but also because of inherited epigenetics. Younger people are worse off health-wise. So we're having a much worse experience even with Medicare and Medicaid. It's literally kind of horrific. Like, you know, I just had some bad experiences where due to, you know, years of being overpaid, you know, overworked, underpaid, deprived of needs and all that, I've had a ton of health issues and injuries and things like that. So I was disabled before I even got my college degree. And that set me up for a lot of problems because then you're stuck with unhealthy situations after that. And I learned the hard way that most of what you need for healthcare is not going to be covered if you have environmental illness, especially, but you know, any kind of chronic health issues, you're going to find that most doctors aren't trained on how to manage your health issues or even diagnose them. If you can't afford $1,000 out of pocket just for the most basic healthcare, you're not going to get your diagnosis, never mind your treatment. And then, you know, Medicare, Medicaid, or any form of insurance is not going to cover any of that. They're not going to cover supplements and things like that that you need. So basically, you know, if you can't make at least, you know, $1,000 or $2,000 a month just to pay for your own health care, it doesn't matter if you have insurance or not, you're still not going to get health care. And again, it doesn't matter if it's Medicaid or Medicare or something private, you know, they're all bad about coverage. So I've had a lot of bad experiences there where, you know, I've ended up with disabling health issues. I had no idea where to go to get help. By the time I figured it out, you know, I couldn't afford it because you have to pay cash. Medicare and Medicaid will say, oh, well, we won't even test your selenium levels with a simple blood test, even though it's essential for your health issues, because we're going to claim that it's not related. So even the most simple things you can't get done through any form of insurance. You know, and you're left with things getting worse and worse. And that ends up harming everybody because a lot of the things that some of us with environmental illness need is stuff that everyone needs, but people haven't figured it out yet. You know, when it comes to accessibility of not just healthcare, but public places and things like that, failing to get equal access and human rights means that everybody is being harmed, and that contributes to cancer and all kinds of other health issues and global warming and everything else that we're dealing with, including all of these early disability rates and all of these rates of people, you know, that are not able to be productive, that are not able to work, that are stuck having to rely on a broken system for everything, and that are costing both the individuals and the government a ton of money. You know, I mean, I've just ended up with a 3-week hospital stay because I can't get access to healthy housing. And I can't get access to medical care. And I almost had to worry about being institutionalized because they were running out of billing codes to use to try to keep me in the hospital long enough to heal enough to be able to take care of myself before they put me back in that living situation that was not appropriate. You know, and that's kind of horrific. And so, you know, not only are there the problems of not being able to get access to the healthcare, but then you have to worry about, because they've got to get creative with the billing codes, if you ever need documentation on why you've ended up in the hospital, you're not going to have that either. So that's not going to be available to help you with getting what you need. And that means that future doctors may not take health issues seriously. And if you ever need to go through any legal processes for anything, you're not.
Oh no. Did we lose you? Give it a second and see if her internet comes back. She's still
People are going to say, oh, well, you don't really need that support. So I'm not even getting the support system stuff that I was supposed to get after the, you know, after the hospitalization, you know, so it's like, you're just left with no support, no coverage, nothing. And that just makes everything worse over time. You know, eventually it's going to keep costing the state more and more money. And, you know, in the meantime, because I can't do all the advocacy work that I need to do, that means that everybody else is also suffering to a greater and greater degree needlessly in a bunch of areas. People with environmental illness, of course, the most, but eventually, you know, employers are paying, you know, more for less productivity. They're paying more for employee insurance. Employees are suffering because of unhealthy work environments. They're getting health issues that are costing them a fortune. And then we have all of the other environmental impacts that are harming everybody and costing people money and causing all kinds of damage. So, you know, I mean, it really hurts everybody not to be able to get basic needs like healthy housing, healthy food, healthy water, and actual health care. And now it's like, I haven't received the bills for my recent round of stuff, but I already couldn't afford the $1,000 a month that I needed for the naturopath or any of my supplements. I can't afford water that doesn't make me vomit, that won't land me back in the emergency room. I don't know what I'm going to do. So, it's probably not going to be very long before I end up back in the hospital again, and I can't even the prescription stuff that should be covered is back ordered and unavailable. So I'm going without it and things are getting worse again. So, it's just a disaster because we can't get the basics.
You brought up a lot of great points, and I've actually said this out loud, and I felt a little embarrassed by it, but I think you just expressed something that I said a lot like years ago about that somebody was like, well, climate change, aren't you going to do something about it? And I was like, here's the thing, I'm really stuck in healthcare because I know if we all have healthcare
yeah.
That we're not paying an arm and a leg for, we might have an army of people that can
right. Yeah. And actually,
issues.
If we get equal access to healthcare for those of us that have environmental illness, equal access to housing, you've got your army right there. We're already working on it,
Right.
We just can't do it effectively.
I recently talked to somebody with Lyme disease, and they are struggling with some similar issues, like just not being believed, not having, not finding the right, any real treatment in our medical world right now.
And what are many Lyme folks? They're also environmental illness folks. What are many autistic folks? Also environmental illness folks. And increasingly we're seeing overlaps with cancer and environmental illness because they're caused by the same things. We need to fix our environment. And part of that means getting basic needs to the people that understand that so we can effectively advocate instead of struggling to survive and drowning while we try to advocate,
Right.
And if we fix things so that the focus was on, meeting needs and on prevention-based policies with the goal of maximizing patient welfare and functionality rather than profits, that would help everybody,
Sure would.
And we need our doctors properly trained.
I want to also just bring up something where sort of like where you started about we were talking about we want to get to Medicare for all. Now I'm one of those people that is like, yeah, I want Medicare for all too, but
and then we want to fix it.
Yeah, we want to fix it. But I also am like, if something else, popped up that felt better, I'm not against that necessarily.
Exactly.
It depends on the policy and a lot of things. But what you were naming too was about how, a lot of these Medicare and Medicaid are becoming more, and Don could speak to this, I think too, is Medicare is becoming privatized right under our nose. And in New Hampshire, Medicaid is essentially managed care, so is being privatized also. And so we are in this kind of situation is like, well, if we don't take it back over and give it to the people, then that could be gone for right.
Yeah, and if we actually got Medicare for all and fixed the program so it actually covered needs, then there would be competition with private insurance, and that would be better for everyone. But we've either got to do that or we've got to create something new, and I don't know which is going to be harder.
Right. For now, I feel like the Medicare for all bill is a great way to do it. It seems, I've actually read all of the pages, and I'm that nerd. But I want to just name that it is 7:12, and we said that this was going to 7, and we generally stay after for conversation. So I want to just say, hey, if you have to go, no worries. You can head out. We really appreciate that you came tonight, and I'll be following up with an email with more links for you all, so you can come to the phone bank in 2 weeks, or not the phone bank, the text bank. You don't even have to talk to people. You just have to press buttons and send messages and respond, and it's awesome. Oh, Don had to pop off. So with that said, I'm so happy that you all came tonight. This has really been a nice meeting. Kate, let's follow up. Kate, I know we've talked before, but would love to talk to you again. Yeah. All right, One North Side. Say hi to One North Side. They're going to do, all right. All right. Thanks for coming, Ryan. We so enjoyed having you, and thank you for telling your story. Oh, thank you for this. Thank you for that link.
No worries. You asked me to.
I just realized Marcella popped off and she was going to be doing some links.
So good to get with you all in New Hampshire. Bright Center Democracy. Awesome organizing. Awesome hearing your stories, and look forward to being in the fight together. First step is to get more people, and we'll take it to the folks
Yeah.
who need to change. Take care, y'all.
Totally. Totally. Yeah. Thanks so much for coming tonight, y'all. Yeah. What does Venceremos mean? Was that a typo or?
No, it means we will overcome,
Ah, I love it. I love it.
right?
Oh, yeah. We will win. We will overcome.
Is that Spanish, Jody?
No, it says it's from, hold on.
Spanish and Portuguese, it says here.
The theme song of Allende's political party, the left during the presidential campaign, is Chile. You're just Chile.
Don is awesome. I'm so glad he made it tonight. Don is a great ally, and PNHP is a great ally in this fight to get to a universal healthcare system. And Michael, I didn't, yeah, let's also, all y'all, let's follow up and get those stories out there. I feel like just even in this group tonight, we already have some stories to tell about the care that we're not getting. Thanks, Matt. We'll talk soon.
Thank you.
Yeah, and Michael and Matthew and Tina, all y'all's. All y'all's. It's really good you came out tonight. I really appreciate it. Tina, you know Beverly. Yeah, cool. And
Now we do.
now you do. Is that through the texting?
I guess, yeah. I'm sorry. I don't know. I guess it was the link. She was having difficulty finding the link.
Yeah.
But you texted it to me and I texted it to her and that worked. So
Cool.
yeah, that worked out
Yeah,
fine.
sorry about that confusion.
A lot of things surfaced tonight. It was really good. You know, a lot of different things came to the surface, and it's good to follow it up. I mean, I don't know. I had two other thoughts, but they keep going. I keep losing those thoughts. But one of the things that there were some people here who are already on Medicare, and I have the potential to be able to sign up for Medicare, but it actually doesn't, other than the deductible, you know, like one thing I didn't bring up was the fact that we pay a premium. So not only do you pay a deductible of $4,500 a year, but we are paying $289 a month for the premium. So almost $300 a month premium. Now that's for 3 people. And that's kind of fair because as Bernie had said in his campaign, he was kind of shooting for $100 a person every month. That's $1,200 a year. That's very affordable. But if I were to go on Medicare, from what I know, and I don't know a lot, I'm going to be doing more research on it. I think it's going to cost me $170 a month. There's a premium for Medicare as well. And I wanted to ask those 2 people who were here, did they pay a premium for Medicare? And what is it? You know, like there is an expense to it, isn't there?
I believe I am under that impression too, that there is.
Well, yeah,
expense.
you know, I have the extra help plans, so I don't have the same charges that some people would have. But I believe it can be up to like $400 a month for some people, depending on what you get. You have choices a little bit as far as your plans. So it depends on what you get. You know, it depends on what plans cover whatever you need. And, you know, it might vary from person to person. And
Sure,
again,
but like if you have big needs, like I'm sorry to interrupt. But if you have big needs, you know, like you've been waitressing your whole life or whatever. I mean, I thought it was interesting, that data that I pulled up, and I think it's something like, Heather, you probably know the total people who are uninsured in the United States that have nothing. But you know, it's not that much. So what I get from all of this is that, you know, whether it's Medicare, Medicaid, private insurance, nobody's happy with what they have. You know, it's really that portion. It's not even uninsured people. I mean, uninsured people are definitely at a much more disadvantage because they can't get any health care at all. But, you know, for the health care that we are trying to get for people who supposedly have it, we're not satisfied with it, you know. And I had the same issue with the Lyme, by the way. I wanted to go see a specialist, although I was a little questionable about what she was telling me to do, but I had to go to like 3 different doctors to finally get the lowdown on Lyme. And I still don't really have it. They never bring it up anymore because I have other primary issues like my DVT and my arthritis and PTDS, all these other things. You know, that's the other thing. You're going through all this and it's causing you stress. And there's no mental
And they only want to
health care.
focus on that. They don't want to focus on the rest of it. You know?
Yeah, and there's and then they don't want to give you like, oh, here are all your therapists, right? They've got 20 pages worth of therapists, and you call them up and you can't get into any of them. They're not taking new patients. And you know, when you get in there and you go back through all your history, you're reliving what you did before. And yeah, you're gonna get post-traumatic stress before the end of it, because you have to keep reliving your own story all the time just to get people to understand it. It's in
And that doesn't help. You know, what we need is actual health care. And we need it covered. You know, we need naturopaths covered.
What?
You know,
Why do you have to tell your story over again every time you go?
so insurance companies don't have to pay for your bills, and they can look for an excuse to not cover what you have while they're wasting your time with your therapist.
Yeah, and
That's
how
about
many
what they
more
do.
visits are, or how many visits are you going to have to take? I mean, even with doctors and specialists, right? Go to a specialist and you have to tell the specialist the whole story all over again. Like, why don't they know the story already? I don't, you know, it's insane.
I feel that. I hate telling it over. Yeah, it gets so annoying when you have to do it again.
All right, well, thank you. This was a really good, I'm
this
your
has been
team
great.
members, and I was like, wow, Heather, this was awesome. And Jody, thank you for preparing, you know, and Jonah, I wish he was here, but he did a very good job.
Yeah,
as
he had
well.
another meeting to get to, I think by 6:30, so he had to hop off too. I did find some numbers for the last 2 years, 28 to 33. I imagine it's gone down somewhat because of COVID and the subsidies and things, and you know, sort of opening of Medicaid up.
But that's ending.
That's
But
not
I
going
would
to
also
last.
say, like, you can't. It's hard to find any actual numbers on underinsured that make any that are valid, maybe. But I would probably argue that most people, if they don't make over $100,000 a year, are underinsured because they cannot afford their premiums plus their deductibles, copays, and out-of-pocket expenses. That that all adds up. I mean, and honestly, my own personal story is like sort of around that, because so you want me to try it? Should I try doing 5 sentences? In 2020, my husband had a surgery to regain the use of his dominant arm. Sentence 1. We carefully budgeted and paid all of our bills and calculated our portion of that we would be expected to pay, and thought we were dotting all our I's, crossing all our T's, and we still received a denial for part of the care from the hospital. We spent an entire year calling both the hospital and Blue Cross Blue Shield, our insurer, and after a year, when we had appealed our denial for the second time, our bill went to collections. The stress during this time that my husband and I endured impacted our own health during that time, and made it harder for my husband to heal from that surgery. And it was overwhelming at times. And I don't know how to end this exactly, except that because of my persistence, or our persistence and tenacity, we kept calling back and spending hours and hours doing this. And eventually they finally paid, or they worked it out amongst themselves, and this was off of our plate. But I was still left at the end realizing how many people were not that stubborn, and were not maybe as educated, or had the tenacity or the skills on some level to keep doing that and keep following up. I mean, it's hard enough for me to remember things in general.
I have a suggestion, Heather. I don't know if this would help in the future if we go this way. this affects people like, when you're saying that, I'm thinking about people who are not that stubborn, like you are determined to get your husband's arm worked out and fixed. But there are people who are like, I can't get a hold of it, that company's just ripping me off. I'm not going to pay. And they're stuck with this for the rest of their life. And then they end up on disability, or maybe not, welfare or whatever. I don't know, homeless even. So there's that end of the spectrum. And then I was thinking about the other end of the spectrum when you said, well, you have to make at least $100,000 a year. Even if you make $100,000 a year, it's not enough. So like if you have a major thing like diabetes or a major operation or something, so we could, like it would be good to get a story from somebody who, and another story from somebody who's like making, like my husband, it would be a good example of that, because he was making $67,000, and this past year his income was over $1,000 because he supplemented himself, and we're still in debt with our, because you have other things you have to pay, like you have $300
I just threw that
premium
number out there because I knew it was higher.
No, it's a good number.
than
It's a
our-
good
than our
number.
median
But
income.
my point is that, you've got your rent, your mortgage, your
Right.
premium and everything. So where do you come up with this extra?
Right.
And then the other thing that I thought I would do if I'd offer, it just came to my mind, is like the history of healthcare. And I don't know if you already know, I don't, but that's what came
Some
up.
of it. I know a lot about Medicare because
Yeah.
Medicare.
Well, that's what came up for me tonight, because
Mhm.
when I had my original car accident in 1980, I was 6 weeks
Maybe
in the
that's something
hospital.
we could do an event on and tell a little bit of the.
Yeah,
you know,
I was in the
like
hospital for
whether-
6 weeks is my point, okay?
Yep.
Who is ever in the hospital for 6 weeks anymore? Nobody. Who was in the hospital for but the reason why was because I got outstanding care. This was at Lakes Region General Hospital in Laconia. But I will say that I got outstanding care, and I would be happy to write out what I mean by this, attention from the doctors and the team. I had a team, and I think they have teams now too, but
They
It
still do that. I'll say that.
I don't know. It's
I
just
know
so,
that they
I'd
do
like to
have
do a contrast of, like in line with the healthcare, the history of healthcare, like how it was and how it is now. Because
Yeah.
obviously, the industry has grown, right?
Right.
And the industry is, now charging more than they were 30 years ago. So why? Obviously we know some of the reasons why, but not really.
Yeah.
I mean, a doctor is a doctor, the procedure is the procedure, granted, I don't know, what is it? The better buildings or the doctors need more money, or, why is it that, and I could even go back and tell you, it was an uninsured motorist. And so I had no insurance, but my mother had to go and get insurance from her insurance to pay the bills.
Oh,
And then
wow.
we actually sued the insurance company to pay the rest of it. But that was something that was done in the 80s,
In the
so
80s.
I don't think we
Well,
could do that.
let's put a pin in that because or put that in the parking lot or whatever they say, because I think
Okay.
that might be something really good. I know we're going to do an event with PNHP, and actually our next two meetings could possibly, right, March, April, and May. I think they have Don let me know that they have an intern that's going to be on, and we have been talking about doing some events like in coalition with them, and one was really going to be about the privatization of Medicare that they have really been focused on. But I think it would be really fun also to do sort of a history of healthcare in the United States kind of program, so that people really understand where we were and how we got here. Because I saw this great film last year. I forget what it was called, but it was about the history of Medicare. And that was stunning because Medicare and I are the same age. Like it was came out in 65, and I just sort of took it for granted. I just knew it was a program. I really didn't know that much about it. It was just like you get old, you get on Medicare. But the history there is that this was supposed to be an equity equity kind of thing, so that Black people, also people of color, got healthcare too, and we left them out. And I am just like, that destroys me, right? Like, how could we have done that? And then we just made it for people, retired people, so that we can still profit off people while they're working hard. And yeah, so it's just so sad that we're in this society where that's like why we're here, basically, is to pay these big corporations.
We're here to be
It
exploited.
just
and it's
doesn't
not
feel like we
surprising.
get, it doesn't feel like we get very good health care. You know, we go in there and you have to fight them tooth and nail even to get your questions answered. I mean, some occasionally you
As I
do.
think Tina brought up, and that's
Yeah.
I've been talking about
And the
this.
same things
friends.
with Michael, is he's having the same issue, right?
Yeah.
So
But
I
I
mean,
think
it's
funny is
common.
people are like, oh, we don't want, am I muted? I can't even tell.
we can
Like,
hear you.
oh, we don't want government to be in control of our healthcare, blah, blah, blah. But then what is the alternative? We want these like private, for-profit, much less accountable corporations to be in charge of our healthcare. Is that who we
do.
want to be the go-between and between us and our doctor, telling us what we can and can't do and what prescriptions we can and can't take? It's absolutely ridiculous. Why do we,
Why are they
a
making medical
doctor
decisions?
says you need it, then you need it. I don't know. That seems reasonable to me.
Yeah, and not just the
Maybe
thing
the
that
corporation is
the
doing it.
pharmaceutical company is trying, or rep is trying to sell them either, which
That's right.
even happening
How I feel.
still. I mean, I literally recently just named the medication I wanted because I knew they were going to offer me something else that was that's just like what they're prescribing now, because it's the in thing and whatever, and it's not, you know. And I was like, no, I want, this is the one I want. This is what's been recommended to me. And luckily I do have good insurance, but I still had to go through an approval process because it was not in their formulary for drugs.
Mhm. And I mean, think about how bad that can
What's
be. We
that?
have I mean, think about how bad that can be with the reps, you know, promoting certain drugs over others. I mean, we can see pretty easily how that pans out in the overdose crisis. Oxycontin.
Right.
I mean, it's yeah, good job, guys.
Well, right, and this drug, this other drug that I didn't get, my sister's just got prescribed it, and she doesn't, whatever, she's not filling it till next month. But I'm hearing from people like on the internet that have the same thing, that it costs $300 or $400 a month even with insurance, and I'm like, well, there's no way I'm gonna. Mine is $10. Come
Well, you
on.
know, I haven't, I don't know how long we have to tell stories, but
Well, we do have to wrap it up because I have another meeting. I've got to go to the Chiropractic Association.
I
Too
have
bad,
several
because I'm really
stories.
enjoying this conversation, by
I am too.
Yeah, this was really good. And where about the slides? Do we have those, Heather? So I can go back and look at them?
We do.
I'll
I have
come up
to.
with like 6 different healthcare stories.
Yeah, right. Yeah. I will. We've been working on the slides all day, and so that's why I didn't.
They were great.
share it with everyone
Okay.
ahead of time. But I will follow up with like a just view only. I have to change settings and stuff, so I'll probably like
Yeah.
follow up with everybody tomorrow.
Good job. on
And
them.
with links and all that stuff that we talked about. Like, if
I
you
mean,
need-
I took notes. I know
Oh,
how to
good,
do the
good.
story, but
Yeah.
it would just be good because I was really impressed with the slides. So thank you
Oh, thanks.
Thanks.
That's great. Oh, Jody.
for all your work. Bye,
Jody's
Jody.
at the State House. all-
Okay, bye. Thank
Well,
you.
good to see you all. Thanks for
Thank
coming.
you.
Thanks.
Enjoy
Bye.
tonight.
Thanks, bye.
Bye, y'all.